Ophthalmic public health matters because it's at the heart of everything we do. Optometrists and opticians do it every day of the week in their practices. I mean, we see about 21 million patients a year. We correct their vision, we correct their sight, we check their eye health, we reassure them, and where we find pathology, we send it off to be treated to prevent them going blind or visually impaired. So it's at the heart of everything that everyone in the profession does every day in practice.
Opticians are healthcare professionals providing an NHS service, and see that as an opportunity to actually engage with your local community, to build a relationship and a rapport, and actually add some value to the service that you provide that actually your customer might value.
We need to add a new focus as well, not only on the individual and individual's well-being, where traditionally our focus has been, but on that individual within the population that they represent. And that's quite a big shift from us, from moving out of a healthcare practice and thinking of ourselves as part of a wider healthcare and eye health network.
Public health is going to be a huge remit for all of us to make sure that we're actually dealing with patients appropriately and when they need care.
There is a real opportunity for leadership. For those people who have vision and commitment and can engage people through their passion, really, and enthusiasm, they're the folks that are going to lead the way forward in terms of the development of eye care services.
I think there's a lot of credibility in any sort of assessment of need that comes from a specialist in the field. When it comes from the voice of somebody that's either affected by the issue or that's got a very special interest in the issue, it adds so much more credibility when they then talk about that issue to the decision makers.
Public health folk have a whole range of important issues they're addressing. Obesity, smoking cessation, things that are focused on mortality, and they will always be the big drivers. So it really is upon us, it's up to us to demonstrate how eye health impacts on a whole variety of morbidity and mortality. If we don't have a united voice, ultimately we're not going to do the best for our patients and for the population at large, and eye health inequalities are in danger of increasing rather than reducing.
Within the community optical sector and indeed the hospital and voluntary optical sector, we need to continue to do the very best for each and every patient, as we've always done and where we've got a very rich and strong tradition. In addition, of course, what we need to be doing is bringing eye health and eye care to those people who currently do not access it. And this is what we can achieve through local eye health networks.
We need to raise the profile of optometry to encourage people to come in for regular eye examinations, because by doing that we're going to prevent vision loss, because we know that 50% of vision loss is actually avoidable if it's picked up early enough.
The government has made very clear that its vision for the NHS is a clinically led service that's patient focused, and that's where we need to move to. By participating in local eye health networks, we should be able to shape the future and the design of local services. There's an enormous amount of work to do. A lot of people who need regular sight testing just do not come for it. And now through local eye health networks, we have the opportunity to start to put that right, to work more closely with our hospital colleagues, sharing care, redesigning pathways, and also with our voluntary sector colleagues to make sure that people are supported at every point of the eye health journey. This is really a chance to, as the government says, make the NHS genuinely clinically led.
It's about working collaboratively to find solutions.
There are plenty of opportunities for opticians to get involved in public health.
And I'm sure most public health teams across the country, as well as CCGs and health and wellbeing boards, would be so grateful if optometrists took that helm and brought it forward.
Unless opticians recognise their role and how they could play a bigger role and a bigger leadership role in improving health locally, then that'll never happen.
We all do a very good job within eye health. We just need to work to those strengths and not be xenophobic about using others to ensure that the patients get the best care.
We've often said in the Optical Confederation that if anyone's going to do anything about improving the eye health of the people of this country, it's optometrists and opticians. Now's our chance. The government has said the service must be clinically led. Let's show them what we can do.